Okay, my people, welcome to my slide today. We are going to talk about the anatomy of the thorax, and as you can see in my slideshow, there is a picture of the thorax showing you the clavicle bone, scapular bone, sternum, the rib cages. So that's what we are going to talk about today. Welcome. Okay, in the introduction, we are going to talk about the thorax as the human body between the abdomen and the neck, forming the chest cavity. It houses vital organs for circulation and respiration, gets protection from the rib cages, the 12 ribs majorly. So this circulation is the heart and the respiration is the lungs. Let's go to boundaries of the thorax. As you can bear with me, if you have done general anatomy, you know about superior, inferior, lateral, anterior, posterior, abduction, adduction. Yeah, those things. So, boundaries of the thorax. Superiorly, it borders the thoracic inlet. Thoracic inlet is the superior aperture. As you know, the thorax has two apertures. We have superior and inferior. Superior is the thoracic inlet and the inferior is the thoracic outlet. Inferiorly, the thorax borders the diaphragm. Laterally, it borders the ribs and intercostal muscles. Anteriorly, it borders the sternum. And posteriorly, the thoracic vertebrae, the T1 to T12. Let's go to thoracic cage. As you can see, I've shown you how a thoracic cage looks like. And it contains the sternum. The sternum you have been shown there. So that part is the sternum. And the sternum has manubrium, body, and xiphoid process. It has 12 pairs of ribs, and in the ribs we have true ribs, false ribs, and floating ribs. Why are they called true ribs? True ribs, majorly rib 1 to 7, they are called true ribs because they articulate or attach to the sternum directly, while the false rib articulates indirectly using the intercostal rib. Then floating ribs has no attachment to any rib, any sternum or any other part of the thorax. Then we have thoracic vertebrae, the T1 to T12. Also we have costal cartilages in the thoracic cage. Majorly this thoracic cage gives protection to the contents of the thorax. Okay, I have an assignment there down. Look at the structure of a rib and intercostal muscles. As you know, we have internal intercostal muscles, external intercostal muscles, and innermost intercostal muscles. Good, let's proceed. Let's talk about thoracic cavity now. Thoracic cavity, it's divided into right pleural cavity, majorly covering up the right lung, then left pleural cavity covering the left lung. We have mediastinum, which is the central compartment containing heart, great vessels, thymus, lymph nodes. We also have the major vessels or circulation now in the thorax. Veins, nerves, arteries. Aorta is the main artery here. Pulmonary arteries and veins also are present. Superior and inferior vena cava also are compromised. Okay, we have layers of thoracic wall. This one comes in when we are doing an incision around the thorax. You go through the skin first as the superficial layer, then you go to superficial fascia, the muscles, ribs, endothoracic fascia, parietal pleura, pleural cavity, and visceral pleura. Then you have clinical relevance. These are now where we apply this knowledge of anatomy. As you know, in trauma injuries, we can get a rib fracture, and mostly it affects the rib 5 to rib 10 because rib 5 to rib 10 are long and they are highly exposed, so they don't have any protection. Also, we have pneumothorax, hemothorax. Management here is always we do a paracentesis or a thoracentesis, not paracentesis. We do tapping from their pleural cavity to remove any fluid in the pleura. Okay, and it is always done in the triangle of safety. You will go through it. Let's talk about cardiovascular diseases. We have coronary artery diseases. Myocardial infarction gets in here. We have pericarditis, endocarditis, myocarditis, respiratory conditions also like asthma and lung cancer, which has affected the pleura. As you know, the thorax contains pleural cavities, the left and right pleural cavities. Good. That is the end of the slide. Thank you and subscribe.